Hello and welcome to the University of Minnesota Psychiatry and Behavioral Sciences Department, Psychiatry Adult Training Program. I am Laura Wixer. I'm the program director here at the University of Minnesota, and I'm just going to tell you a little bit about myself and then talk a little bit about the program. So I'm a cisgendered white woman. I grew up in the Twin Cities here, so I have been here a while, and I have a lot to share about why I think our program is really excellent. I know that I have tremendous privilege, and I work every day to better understand that and wield it in the service of those who need allies. So my role here in the department is program director for the residency, and then I also am clerkship director for the medical student clerkship, and I have another role called deputy vice chair of education, which basically means I get to think about all the education that we do in our department, and it's very exciting. I've been program director since July of 2020, so I'm brand new to this role. Our previous program director, Kaz Nelson, is still here as vice chair of education, so we still get to work together. I'm actually a quadruple gopher, which means I've been at the University of Minnesota since undergrad, medical school, residency. I did my chief resident year here, and now I'm on faculty, and I was associate program director for 3 years. So here I am now. I have my dream job, and I'm really excited to talk to you guys a little bit about that. Some of the things that are important to me in my role and in my job, I work on the inpatient psychosis unit, so I take care of adults with psychosis primarily, and I have a particular lens of quality improvement and patient safety, which are important to me. In my role as an educator, I will tell you that some specific things about me are that I focus a lot on equity and justice, anti-racism, inclusion, and for starting at the top, with faculty, then with residents and fellows and medical students and everyone who can model for our future learners and future colleagues. And with that lens also is that I know that parenting brings value in our learners, and so just so you know that I have that lens as well. There's no downside to being a parent or a caregiver of any kind in medical training. I think it makes, if it's something you choose to do, I think it'll make you better. Okay, so what are we looking for in future residents? We're an exciting program. We have a lot of opportunities to make your residency a unique experience here. We are a group of colleagues and friends. We support each other. We're looking for residents who will bring new life experiences and expertise to our program, help us grow our program, bring it to the next level. We commit to training our residents to be exceptional psychiatrists, and we ask our residents to commit to providing honest feedback to our program and help make it better while they're here. Times have been really, really tough lately, and so our primary goal, given that, is to stay well, support each other, use our energy to improve our world for the future psychiatrists and, of course, for our patients. Part of how I do this, I just thought I'd share, is I do have a dog. She's right here. I'm going to pick her up. She's pretty big. There she is. All right. So we all do it differently. Oh, come here, sweetie. Okay. We all take care of ourselves differently and find joy in the ways that we can, and that's really important. And so thanks for listening. We really are doing our best these days, like everybody is, and we can't wait to potentially we'll get to meet you, we'll get your application, and we look forward to working with you as colleagues in the future, whatever role that is. So take care, everyone.